welcome. I am Jessie Whittish with Kentucky Youth Advocates, and we are happy to have all of you here for a discussion about strengthening families and preventing child abuse. Just a reminder that we are recording today's forum to share as both a video and a podcast. So we ask that you stay muted, but if you'd like to ask questions of our panelists, please drop those in the chat, and either they'll answer them or we can follow up with them and get that answer to you later. And with that, I'm going to turn it over to Terry Brooks.
All right. Hey, thanks, Jessie. So Jessie has asked that I kind of dig into Loyola's full court press. Oh, no, I'm sorry. That's the next meeting. Okay. Sorry about that. Hey, we appreciate all of you guys being here today. I think this is Forum 45 for us. Y'all know that we have had congressmen and governors and the legislators and community champions. And we're just delighted today to have sort of I think Jessie said they were an all-star panel. She did mention to me that all of the really bright people on the panel today were female, and then asked me to draw my own conclusion. Thank you so much, Jessie. So the other thing, and I know Courtney will do this, but I want to ramp this up. The next 2 weeks are big weeks. Next week, we have legislators doing a summative look back at the 2020-2021 session. The next week, we are going to bring a real focus on the federal issues at play right now as part of COVID. We're bringing in who we regard as the best thinker nationally on federal funds and kids, especially folks like you frisky people. Lots of opportunities if we're smart. So if you want to get coached up on that federal opportunities, Wednesday after next is the time to do that. Okay. So today's focus is really a predicate to April, which, as you know, surely is Child Abuse Prevention Month. And, you know, I have to tell you, I'm somebody that wishes April would just go away for that, because I wish we didn't have to talk about it, but we do. You know, as long as Kentucky continues to lead the nation in abuse and neglect, we have an ethical obligation to put that front and center. And if Kentucky was the best in the nation, and yet a single kid was being abused, we still have an ethical obligation to look at that. Prior to 2013, lots of good folks were doing lots of good work in abuse and neglect, but not a lot was happening, frankly. And then Kosair Charities stepped in and said, could we make a commitment to work together? And that was when the Face It campaign to end child abuse was born. And since then, we have had a multiplicative progress because of the charities quarterbacking. Don't want to switch sports too often. Quarterback is football, brackets basketball, but the charities has really been quarterbacking this effort. What I admire about the charities is that they recognize the importance of macro issues in Frankfurt. So last week, issue after issue after issue passed. Yesterday, the governor signed 4 or 5 bills all around the Face It priorities of protecting kids. So don't let anybody tell you that nothing is happening in Frankfurt, because when it comes to child abuse, it is. By the same token, the charities recognizes on the ground efforts. So many of y'all represent nonprofits or entities like Friskies that are absolutely essential in addressing this. The charities also recognizes the role of parents. And that's what we're going to talk about today. We know that if we're ever going to get ahead of the curve, if we're ever going to move to an emphasis on prevention rather than tragedy, if we're ever going to make prevention the focus rather than mitigation, we have to think about parents. And that's what today's topic is. So one of those quarterbacks from the Charities team is sort of the guru of today's forum. And it's a pleasure for me to introduce Lindsay Ware. Lindsay, I know you know, but I just need to publicly say what a creative, innovative, and powerful force the Charities is when it comes to protecting kids in all 120 counties in the Commonwealth. And we consider it an honor and a humbling experience to work with you guys. So thanks for being here.
What a humbling way to start out. Thank you, Terry. And many of you know I'm a huge sports advocate and just fan of everything. But no matter what your sport is or your team is, our loyalty is to the kids and families of this state. So that's a great unifying, no matter whether you're cheering for a red team or a blue team or anything in between. I'm really excited and honored to be with each of you today to represent the Kosair Charities Face It movement. The movement, like Terry said, officially began in 2013 in response to the unacceptable incidences of child abuse and neglect. At that time, we set a bold goal of ending this horrible pandemic in its own right by 2023. And that's getting close. But while sadly, this problem will not be gone by then, there are several crucial milestones that we can reach to protect and save Kentucky children. Face It has a three-pronged approach to ending child abuse and neglect. And the first is promoting best practices. We're all here today to do just that. Next is engaging the community in this wider effort. And the third is advocate for state and local policy, which I know many of you experts on this call today have been, in the trenches and that topic over the past weeks, months, and an entire year. But all three of these are important when it comes to today's conversation about strengthening families. One of those doesn't happen without the other. They all intersect. Child Abuse Prevention Month begins next week. I don't know how it's already April.
Hey.
But related to these crucial topics, there are many events. I'm sure your all's calendar are going to fill out really quickly in April. And some of those events are organized by our now more than 100 Face It partners. In 2013, we began with just around 4 or 5. We are now over 100. This is not a bracket game. This is all teams on deck and everybody that can lend their expertise and their passion and their wisdom. Please join us in those efforts. So now to game time, now to the main event. I'm honored to kick today's conversation with these incredible panelists. I'm going to turn it over to Shannon Moody. Thank you all.
Thank you so much, Lindsay. And none of this would be possible without Kosair Charities support and commitment to making sure that kids are free from abuse in Kentucky. Kosair is the reason why Face It exists, and they're the reason why Face It is so successful. So that being said, we've got a couple of Face It partners. We also have a couple of folks from across the state who have been engaged in some way or another with the Face It movement, and we're going to talk a little bit about some data and some just researchy things before we jump into the conversation. So I always do this. I'm Shannon Moody with Kentucky Youth Advocates. I oversee our major initiatives, including the Face It movement and Bounce Coalition. So we've got 2 slides. The first one is us talking and presenting on what the current data says. So Terry had mentioned we have the highest rate of abuse in the nation. This is for the 3rd year in a row. And there are a lot of reasons for this. Some of them because we're really good at recognition. Some of them because we have a ton of risk factors within our families that we need to figure out how to better address on a deeper level and address those root causes. Kentucky is also double the national rate of child abuse victims under the age of 1, and we are 3rd highest in the nation for that. We know that our kiddos, our young kids, are most vulnerable to fatality and near fatality when they're under the age of 4. That is something that we need to make sure that we're really trying to figure out how to wrap our arms around families with young kids and as well as young parents. What we also know is that of all maltreatment that occurred in Kentucky, 88% of it involves neglect, excluding medical neglect. So what that tells us is a large issue within the Commonwealth is not just physical abuse, it's also those issues that can create neglect situations, whether it's untreated substance use issues, untreated mental health, and some other risk factors that we'll talk about later on. And then also the most prevalent risk factors in the home in Kentucky are substance abuse and domestic violence. Over 50% for both of those factors are present in substantiated cases of abuse and neglect. So what do we do about that? Child abuse can be really overwhelming to talk about, but we know what research tells us about what we can do to build in some protective factors and some components within our families in order to prevent abuse from ever occurring. So there's a huge list here. This is what research tells us is what keeps kids safe in their homes. And we know that a lot of these things have to do with what our service providers out in the state bring along with them and provide support to families around. So meeting those basic needs, making sure that parents have a good sense of what normal child development looks like, and making sure that we're talking to families and kids about what safety looks like and what body boundaries look like. So we will get into protective factors with this group because this group is like superheroes when we talk about protection and protective factors and building up and strengthening our families. But we wanted to just make sure that we had good foundational knowledge before we jumped right into what protective factors are, because that's a little bit wonky. So I am excited because we've got a lot of great folks today. And I'm going to do just super brief introductions and we'll jump into questions. And I would love for our panelists to just expound on that a little bit more as they're talking about what they do. But we've got Tonya Jernigan from UK Division of Pediatric Forensic Medicine. She's a principal social worker there. Melissa Goins, who is the director of the Kentucky Division of Family Resource and Youth Services Centers. I always just want to say Friskies. Julia Gordon, who is also with the Family Resource Youth. She's a Family Resource Center coordinator in Kenton County. And then Emily Keely with the Kentucky Strengthening Families program. So we're going to start with a question for all folks. And that is around, what do your families, what are the, in your roles, like how do you build protective factors within your families to prevent child maltreatment? What does that look like in your role? And anyone who is brave enough and willing enough to just jump in, please go.
So I'll start. So I'm Melissa with the Family Resource and Youth Services Centers. I could talk about protective factors a lot. So I made some notes so that I could stay on task because I get super passionate about it. So the whole idea of Family Resource Youth Services Centers is built on protective factors. When Family Resource Centers were constructed and the idea for them came about, it was to target kids who needed a little bit of help leveling the playing field with their peers, who found themselves in situations that no fault of their own, they had less protective factors or more risk factors, or however you like saying that. And so everything from the way that our funding is allocated to eligibility for schools to have a FRISC, and then our framework for our program, and then the activities that our FRISC do all go back to building protective factors for both students and their parents, grandparents, anyone who is raising them. And we made it even more concrete in the last few few years, because I wanted not just our FRIS to understand that, but also how to connect their everyday work to it. And so we implemented some statewide standards over the last couple of years, and they are built on both the strengthening families protective factors and the principles of family support practice. And so we wanted to make sure that our FRIS, as they were building their activities for their 2-year plan based on their community needs, really connected their work with those protective factors, and they could see that connection to prevent child maltreatment and just increase success for children and families. So that's how we do it at the large level of FRIS. And I know that Julia probably has some more like smaller scope examples.
So my name is Julia Goodman, and I'm the Family Resource Center Coordinator here at Beech Grove Elementary School in Kenton County. One way that we're building those protective factors is by offering the Born Learning Academy. In 2009, Beech Grove was actually the first school that piloted the program. And we teach our parents, we provide dinner, we provide childcare for the families, and then we work with families on just various workshops. And the Born Learning Academy is geared toward that 0 to 5 age group. And so we're really meeting the needs of those families. We provide sessions for on brain development, nutrition and health, learning the importance of routines, the importance of reading with their children. And there's so many ways that we're helping to connect and increasing their knowledge that puts these protective factors in place.
Thanks, Julia. And I think if folks did not hear quite what Julia was saying, because it was a little bit quiet, hopefully she will talk a little bit more about those Born Learning Academies in greater detail, probably throughout the conversation as well. Emily, as far as Kentucky Strengthening Families, what does that look like for you all?
Sure. Well, just a little bit about, I guess, my role. So I'm the early childhood social emotional consultant with Department for Public Health and overseeing this Kentucky Strengthening Families initiative throughout Kentucky. And Melissa and Julia, I love the what you all are doing with Friskies and Julia in your community, because these are definitely strategies being intentional in working with our children and families. But I would like to kind of lay a little bit of foundation with how Strengthening Families kind of came about in Kentucky. So this Kentucky Strengthening Families represents a multidisciplinary partnership of over 20 national, state and local, and public and private organizations that have been dedicated to embedding 6 research-based protective factors into services and supports for children and their families. And those 6 protective factors were highlighted in that list that Shannon had showed earlier in that slide. So supporting families is really a key strategy for promoting school readiness and preventing that child abuse and neglect. And so the important thing to know about Strengthening Families and then protective factors is that all families experience times of stress. So we're not just working with at-risk families. Really, all families can benefit. And research demonstrates that children grow and learn best in families who have the supports and skills to deal with those times. So by supporting families and building their skills to cope with stressors, we can increase school readiness and reduce the likelihood abuse and neglect will occur in families. So all Kentucky families can benefit from these comprehensive efforts to build protective factors. And so the 6 protective factors that really encompass this Kentucky Strengthening Family Initiative are the parental resilience, social connections, knowledge of child development, concrete supports in times of need, social emotional competence, and most importantly is nurturing and attachment with families. So lastly, like these protective factors really lay the foundation for the Kentucky Strengthening Families framework, which when present helps increase that health and well-being of families and children and reduce the risk of child abuse and neglect. So really this Kentucky Strengthening Families was Kentucky's response to that huge ACEs, that Adverse Childhood Experiences study that was done several years ago. So a lot of key players really kind of came to the table and several years ago and developed this initiative. And so we, at the state level, we have put together training. So Kentucky Strengthening Families training, which includes training such as Family Thrive, Connect the Dots, and Parent Cafes. And so my primary role is really to educate folks across the state on what these initiatives are, so we can all kind of speak the same language and have a common approach when working with families.
Thanks, Emily. And yeah, strengthening families is, I think, something that a lot of folks are aware of and have seen in action with those parent cafes or that training in their community. I think Emily brought a critical point, which was all families struggle at some point or another. Parenting is tough, and we know that. Tonya, I know that you have seen parents probably at times when they have experienced or when maltreatment has already occurred. So can you talk a little bit about what your program does for wraparound and preventing future maltreatment?
Sure, yeah. So as Shannon had mentioned, I'm with Pediatric Forensic Medicine at UK, and I know most people don't think of us as prevention, right? Because we're the folks who get called in to identify serious maltreatment after it's occurred, whether that's any kind of medical neglect, sexual abuse, or physical abuse. But, you know, I think one of the things that we do that's really different than, there aren't very many forensics programs across the nation anyway. There are only about 240 child abuse pediatricians across the nation and only 5 in Kentucky to serve all Kentucky's children. And as we know, we're #1, so there are a lot of children to serve. And so one of the things that we do really differently at UK PFM is that we have an interdisciplinary team of physician, advanced practice providers, forensic nurses, and social workers. And I know I'm a social worker, so I'm a little partial, but I do think that cohesive team is incredibly important because, you know, when we sit down to interview caregivers about, you know, when their kiddos have presented to the ED or into our clinic for injuries, we're not just looking at the physical injuries. We're doing a really thorough psychosocial history with those families to fully understand the risk and the protective factors that are present. Because, you know, just because a family is presenting for a serious case of maltreatment doesn't mean that there's not some protective factor to build upon and to find a way to build resilience back in that entire family unit, but importantly also in that child. And so I think that's one of those things that we do as a team really well, to kind of foster those protective factors and to build resilience. You know, our work doesn't end when those kids leave and families leave the ED or leave our clinic. So we're constantly working really closely with CPS and with other childhood providers to get families into services that are needed. You know, one of the things, and I think Shannon talked about this, is, you know, Kentucky's rates of substance misuse and intimate partner violence are incredibly high. When you look at their co-occurrence with child maltreatment, and they're much higher than the national average as well, right? So not only is our, you know, our rate of child abuse really high, but the co-occurrence of all of those 3 things together is really high too. And so having that IDT approach, that interdisciplinary team approach, allows us to recognize that parents are struggling with issues of mental health. They're struggling with issues of family violence. They're struggling with substance misuse. And we're able to refer those families to services that are needed, right? Because, you know, even if a child is removed from the home, right, the ultimate goal, if it's safe, is to reunite that family. And we've got to help parents get the services they need as well, to make a safe network. So one of the things that we're really focusing on is, and that's incredibly unique, is a non-offending caregiver group. I've only been with PFM for about the last 10, 11 months or so. And I bring with me a pretty decent history of work in substance misuse and IPV. And, you know, unfortunately, Kentucky homes aren't just not safe for kids. They're just not safe, right? Kentucky's homes are not safe for the adults that live in them, and they're not safe for the kids that live in them. And so one of the things that we have noticed is that non-offending caregivers need a place to find support They need intense education about normal childhood development. They need a place to process their own trauma and grief as it relates to the violence that's occurred to their child. And more importantly, I think that we continue to see a multi-generational kind of cycle of violence in Kentucky. We're expecting parents to provide things for their children that they don't have the skill set to provide, right? So we've got parents who are hurting, who didn't have a strong, secure attachment with their own parents, and we're expecting them to do that for their own kids, and they can't do that. We would never expect our children to try to perform a task that they weren't ready to perform, but we're asking adults in Kentucky to do that, and they're not ready to do it. And so that's one of the things that we're really focusing on with the non-offending caregiver group and those kind of wraparound support services that we have a CSW on staff who provides a lot of case management. And so to be able to provide those wraparound services to family members as well is preventative in the fact that we're going to stop further maltreatment from occurring.
And Tonya, what I think I heard you say also is it's not about bad parents. It's about people who are struggling to figure out what parenting looks like for them as they are still processing things that maybe they dealt with when they were growing up, or processing things that they're dealing with right now, which can hinder their ability to parent in the way that they want to. And I think that's what we often try to highlight and make sure that people understand, that people don't wake up one day and decide that they're going to abuse their child. They wake up day after day, overwhelmed, stressed, or isolated, or dealing with different issues that are being unaddressed and creating more tension or problems in the home that results then in negative outcomes. So a lot of what you all do is really help to address that unit, right? And help to reduce some of that stress and reduce that isolation. So what does that look like? So what are some of the results that you've seen in your work related to keeping kids safe or supporting families? Like how do you measure success in the work that you do? And that could be for anyone.
I'll go if it's okay. So I think one of the things that we've done, so PFM generally serves kind of the eastern half of the state. So if you kind of think about DCBS regions, it's easiest. So the northern bluegrass, southern bluegrass, Cumberland, northeastern and eastern mountain. And one of the things that we've done is we've established multidisciplinary teams in 3 of those regions today, which is a really great collaboration between medical providers, child protective services, law enforcement, child advocacy centers, and other kind of key partners. And so I think that really allows for a really kind of demonstrated has really demonstrated some really good accountability for perpetrators of these cases as well, because we're all communicating, we're all talking, we're reviewing cases in real time, we're providing key information, to law enforcement that probably wouldn't understand some of the kind of the uniqueness of child maltreatment and kind of the injuries that come along with that. And kind of what that looks for families, and then really being able to communicate with CPS workers, investigative and ongoing as well, about what we have seen that this particular family could really benefit from, based on the history of the child, based on the history of the parents, and kind of what strengths they're coming to the table with presently. And the interesting thing is that in those 3 regions, every time we've established an MDT, we have seen a significant increase in cases that are brought before us to review for consults. It doesn't mean that like us magically, showing up there magically brings more cases of child maltreatment, but I think that people are really incredibly thirsty for someone to talk to about these cases, and they're thirsty for that knowledge, and they want that collaboration. And so I think that has been incredibly helpful. Because it may not just be that one child who's suffering maltreatment, right? So if we can intervene for that one index patient, we may be able to prevent further maltreatment for families. And I think the other kind of a really good case example, one of the things that we've seen since the pandemic has started is that we've had several cases of childhood torture. I think part of that is because kids are home, right? They're not getting out. Parents are incredibly stressed, and parents are just with their children more. And this particular case really required a lot of coordination between law enforcement, providers, the caregiver that the child usually lived with, and that had to cross 2 states, right? So we were coordinating so much care for this family, and being able to get a child in for a forensic interview before he left the hospital, which is really difficult to do because the CACs are incredibly busy. Being able to get a child referred and in care in his home state before he ever left Lexington, and being able to get those parents, the non-offending caregiver, those services in place as well was a really, I think, a great sign of success for us. And I know that recognizing more maltreatment isn't necessarily a success factor, but I think if we are identifying more and we're serving more families, then I think that is success.
I'll also add, I think when I think about measuring success, there's a lot of different things that come to my mind, but I think that increasing coping for parents and grandparents is probably the biggest area where I think that frisks have moved our needle. I think that we do this in several ways. We do use the parent cafe model for our grandparents and parents. So hopefully that is building resiliency and connecting parents with other parents that are going through similar life experiences, and solidifying those concrete supports in times of need. They can call on each other and their community. I also think, and I don't want to steal Julia's thunder, but I might be, but through our things like our Born Learning and our early childhood piece, we definitely try to educate on normal milestones with child development, because we know that that is a protective factor against child maltreatment. And, just that kind of micro level, during the pandemic and before and then after, we are making referrals, trying to identify where we're seeing parents that are in need or grandparents that are in need of support. Sometimes that means a porch drop off, and sometimes that means connecting them with behavioral health services in their community. I think, during the pandemic, in the March, when, our schools closed in March, from March to June, our frisks coordinated 49,000 home visits. Schools were shut down. We were used to seeing kids every day. And so we just saw kids every day. We just went to them. And so having those conversations with parents who needed a new Chromebook, or, a mom who was just struggling for whatever reason, allowed us to make those connections ourselves, coordinate more resources for them, both formally and informally, right? And so I think that is what I think about. I do want to say a little bit about measuring, because a lot of that was just kind of broad. So we have on our website impact reports. We have impact report spotlights from about 2016 to 2021. We ask our frisks to measure a lot of stuff at the local level because our program is so locally driven. They assess gaps and then have flexibility locally to implement their programming. So I invite anybody that wants to go to our website. They're super easy to find, and I really mean that. That's not sarcasm. They really are super easy to find. You just scroll down. I know CHFS's website can be crazy, but it is not hard to find. And they're organized by category. So we've seen things like academic results. We've seen pro-social behavior increases in children. We've seen all kinds of things if you're really interested in those pieces. But I think by and large, just making sure that parents, grandparents, caregivers have what they need to cope in this ever-changing roller coaster of pandemics within epidemics within, all the emics, I think is our primary role.
Yeah, and I want to back that up. So, at the state level, how we measure success is Melissa and Julia, and like with the frisk, and incorporating those protective factors in their best practices and their procedures. They're doing it. They're doing this. They're being intentional. So you all are really like the role models and being intentional and using protective factors in the work that you're doing. And so that's how at this state level, okay, well, we're doing something right, you know, where organizations are incorporating the protective factors in the work that they do. So I'm fairly new in my position, and reaching out and just hearing about different organizations and communities who are being intentional with using parent cafes within their community and engaging families and caregivers, and, you know, not just parents, but caregivers too. You know, we want to look at like the grandparent population as well. Those are successes. Those are successes for us. But, you know, at the state level, we do have a goal to reach more people. And I really appreciate being invited to participate today, because I'm hoping that this is an avenue, this is an opportunity for more people to get excited about this Kentucky Strengthening Families initiative and this movement. And, you know, if you're excited about and you're passionate about helping children and families, then one of the things that you can do is go to a training, participate in a Kentucky Strengthening Families training to learn more about protective factors and learn how these protective factors can really change and transform the work that you're doing.
So can we just really quickly, because we've mentioned parent cafes a couple of times, but for folks who might not be familiar with what a parent cafe is, can somebody just give like a little snippet of what that is and what it does?
Yeah, well, sure. So parent cafes, well, typically these are done like in person, but now we've really kind of transitioned to this kind of virtual platform for parent cafes. But it's an opportunity for parents, caregivers to get together to really have like true conversations about experiences that they're facing. So challenges and successes that they're facing as caring for children. So the whole purpose of a parent cafe is that we want it to be a safe environment. These are questions that are geared towards one of the 6 protective factors that we mentioned earlier. And it's an opportunity, again, you know, one of those protective factors is concrete supports. So parents and caregivers being involved in a cafe and really learning that, okay, well, this other person is experiencing the same thing that I'm experiencing with my child. You know, I'm not the only one who's dealing with this, that has this challenge. Well, let's connect outside of this and really be a support to each other. So that's gaining that network of support, which is really enhancing that protective factor of concrete supports in times of need, right? And so it's really just an opportunity. You know, these are conversations that are led by parents. They're for parents. And really it's us, you know, the providers are really kind of facilitating these guided conversations in hopes that parents will have an opportunity to feel safe to discuss, discuss what's going on, and then hopefully gain some information or some strategies to use with their own children.
It sounds
It's
like
also super low. It's a super low cost intervention. I just wanted to say that. It's because I had to think about that.
yeah, very important. And it sounds like a good space for parents, to come together if they're just uncertain, because there's a lot of uncertainty in parenting and a lot of shame sometimes in parenting. So connecting with other parents seems like a really critical opportunity to create some good conversation. Julia, what does success look like for your work, and particularly for the Born Learning Academy?
So right now, you can let me know, but it's showing that I'm having connectivity issues. Can you hear me okay?
Yeah, sort of. You're quite a bit low still, but if but keep going.
Okay. Well, the issue is I'm here at school, and so everyone is logged on to our network, and that's why we're having a little bit of issues. So I'm sorry. And I couldn't do this at home because I have kids at home learning, so I couldn't get it home either. So I apologize for that. But for Born Learning, when we started the program in 2009, we had 15 families go through, and we were thrilled with those results. But just last year, we had 37 families participate. And this year, even through our pandemic, we had 42 families that began our Born Learning Academy. They And what was so crazy about it was, you know, I had no idea what we would do in this virtual. Our school was shut down. What it was going to look like, but I had parents and community partners contacting me, wondering, you know, what's learning going to look like, and that program grew from 42 families to 69 families just last month that were participating in the Born Learning Academy. And you know what Tonya said, how parents are thirsty for knowledge. You know, that is a perfect description for the Born Learning Academy. You know, I have the only complaint that I've really gotten from families is that they want more workshops. You know, they would like for me to provide something, you know, a couple times a month. So we've seen an increase in parents participating. I've seen an increase of parents recruiting other family members or caregivers, grandparents. I have so many different types of people who are coming. And the funny thing is that when I came here at Beach Grove, we're such a school, and I go across, you know, to another school in their district. Well, I have coming back who are attending Born Learning because they love this program so much and they want to be involved. Were you going to see something?
Go ahead, Melissa.
Yeah.
Julia, you're kind of breaking up there at the end. I think Melissa was going to fill in for you.
Yeah. I was just going to say that the big thing that I think we want to take away from that is that she saw 69 families participate in Born Learning, even though it was virtual, and that the whole idea of Born Learning is to give parents knowledge of child development and then also connectivity. And so for her, she has a pre-post test, so she can measure, you know, what they knew coming in and what they know going out. But I think then that's great. I think beyond that, having her community come to her, and because her community really rallies around this program to say, what is this going to look like virtually? When can we start? How are we going to do this? Because she really has that support. So it's really a group effort, which I think is a measurement in itself. So, yeah.
So based on that, it sounds like you've got, especially in Kenton County, a community of folks who are saying, like, we want more of this. We want to figure out how to get more involved. Based on your all's perspectives, what are other ways? I feel like that's a form of advocacy, right? Like, you know, lifting up and identifying what your community needs. What are some other ways that advocates, maybe on today's forum or for folks who are listening at another time, what do you think that they can do to help build stronger families? What does that look like from your perspective?
So I'll go, and I will just say, finding like-minded people in your community and connecting, and also talking to families and seeing what they need. They are the experts. I think, you know, and I know I'm getting into policy a little bit, but I think sometimes we try to create things without really engaging them at the highest level. And so I think that's super important. If you're familiar with Hart's Ladder, it shows the different levels of youth and family engagement. And I love it because it keeps me accountable. If we say that we're going to partner with families or have families as members of our advisory councils, and their role is that lived experience, you know, piece, then are we doing that at the highest level? When are we doing that? Are we doing that like after we're on step 5, or are we doing it at like step 1? To say what is the best way for us to get where we need to go with them in the beginning. So that is my biggest thing when I think about, you know, advocating for families.
And then let me add on that. So, you know, for us, like at the state level, so really our goal is training. So we want to provide training to childcare professionals, parents, caregivers on ways that you can utilize as protective factors daily. So we really want to try to train anyone working with children and families. So this really is our goal. And so what can you do? So learn about Kentucky Strengthening Families. learn how protective factors can help all families, not just at risk families. Learn how to promote those positive childhood experiences that can really help reverse that trend that we're seeing with the connection between ACEs as adverse childhood experiences and severe health issues in adults. So we would like to help your organization or you individually put this valuable information into action. And so reach out to me. I'll share my contact information. I'm sure Jesse will share contact information for all of us in a follow-up email. So reach out if you're interested in participating in a training or maybe becoming a trainer in your community or your organization. And you're really passionate about continuing this Kentucky Strengthening Families initiative within your community. So this really is our goal.
Thanks, Emily. Tonya, do you have thoughts on that?
Yeah, so one thing in particular, I think, so UKPFM and K-SPAN and Face It partnered as part of the CDC grant to create a new resource that you can find on the Face It website called Connect. And it really is, the grant is focused on kind of building resilience during public health emergencies, but we need resilience all the time, not just during public health emergencies. So you can use it forever. But, you know, we really recognize the toll that the pandemic was taking on families. And we know that when there's you know, major public health crisis, economic crises, we know that families experience ACEs at greater rates. And so we really wanted to focus on helping families have really concrete tools for building resilience. You know, I think, you know, and Julia talks about this, you know, parents want information, they want knowledge, but I also think they like our brains, we are all just incredibly overstimulated right now. And so I think having really concrete steps, right? I think we all like step 1, 2, 3, 4, 5, do this to make a resilient child, right? And it's not that simple, but I think that this Connect brochure really breaks it down for families. And so hopefully you guys can go to the Face It webpage and find that Connect resource. But not only is it a really great mnemonic that focuses on really good tools for building resilience. So, and I'm going to run through them really quickly. So call for help, offer one-on-one opportunities, navigate your networks, notice triggers, take breaks, and know when things are escalating, eat together, care for yourself, and take time to talk. Like those are really simple skills, but families forget to do those. And more importantly, you know, I think, you know, in my training as a clinician, what I always wanted to let clients know is when they were doing something that was super beneficial for their growth, right? And sometimes they didn't know, right? Like they would say they were doing something and you would say, oh, that's amazing. Did you know that that's a really great coping skill? And they look so surprised, right? And so sometimes families just need a reminder that, hey, you're doing good stuff right now, right? Like you're doing good things. And so the other great thing I think about this new kind of resource for families is that there's a QR code on the brochure. Families just have to click that QR code and it's going to take them to a really great webpage, right? Where they're going to be able to find resources across the state. Because I think, you know, we all know that when we're in times of crisis, we've experienced the trauma, that executive functioning kind of goes out the window, and we don't want to have to search high and low for resources. So if we can get families to a one page, right, one page on the internet where they can find everything they need, hopefully that's going to be incredibly beneficial for them. So I really encourage you to print off those brochures, order them from Face It. I don't work for Face It, but a plug that they have lots of really great resources that are just really awesome tools to have for families and for providers as well. So you're welcome for that free PR.
Definitely appreciated. And I also love that, like, you're right, we need really concrete, I would love a list of, you know, how to be a successful adult sometimes, because sometimes you just get so wrapped up in everything that you kind of forget. And also, like, I think that your point about helping families understand when they are just doing a great job or when they are making progress, when they're not recognizing it, the more that we can champion parents and caregivers, the better. I think the more times we can go into a grocery store and watch a parent very patiently deal with their tantruming toddler, like, you know, give them like a high, not a physical high five right now, but like a, you know, some acknowledgement that like, hey, you're doing well, even during this really hard time, and way to go. I think that is super, super important. And yeah, thank you for the plug. We've got one last question, and it is related to policy. So I don't know if Melissa will have thoughts, but I think, what are some policies, whether on the state or federal level, that you think would ensure Kentucky can better support our families?
I do have thoughts. I think that I'll be quick, but a concrete answer. I think if we say that our values are around nurturing and attachment, that we need to make it available for parents to be home with their kids for 12 weeks after adoption, after childbirth, regardless of their leave status, regardless if they have sick time, all of those things. So I will just say that super quick. It connects back to everything that we talked about today. I could go on and on, but I'll keep it simple and just talk about that. And that's it.
That's a beautiful example. Other folks?
I'll just second what Melissa.
Go ahead, Tonya.
Sorry, Shannon. No, I'll just second what Melissa said about definitely about attachment and paid parental leave. I think is a huge issue that we need in Kentucky and across the nation. But also, I think you know, one of the gaps, we have a lot of really marvelous parenting education programs across the state that a lot of providers use. But I do think that one of the missing links in some of that is that issue of we have adults and parents who are unable to form really good bonds and attachments with their children because of their own trauma. And I think that as much as we can find ways to weave that into our policy, yes, I see your chat at the HANDS program. I kind of wish that was just a requirement. I feel like every parent should do the HANDS program. I wish I would have done that. As a young, you know, when I had young children, but really being able to really make a focus on that really important piece of attachment and bonding. You can't have resilient children if you don't have that foundational piece of a really secure attachment and that really good bond between parent and caregiver. And I think that's going to be crucial as we move forward.
To also add to that we need to do some work on reducing the stigma for education like that. Who here was offended if someone said, you should go to a parenting class? Right? I mean, we sometimes, you know, I think of court when I think that, right? A lot of times we court order parenting classes. And so I think that we need to reduce the stigma that you should know what you're doing as a parent. None of us really know none of us know all the answers. All of us have things to learn. Some of us have resources to pull from, and some of us have zero resources to pull from. We're all at different places. No one is born with the knowledge, and they certainly don't come with handbooks. And so I think normalizing this is just like you go to childbirth classes. A lot of us, it's a little bit less stigmatized, right? Like, I need to know how this is going to go for me because I didn't know. I've never had a baby before. Why not have that right away, right from the pediatrician or an OB? Just say, and then this is the next step. Here are just some basics on child development. Here's some basics on discipline. Here's some basics, you know, on just some things that will make things easier for you. We promise. And it should be free to you because, right, it's already out there. We have nurturing parenting. We have so many things out there that are so good. And people don't access them because I think lots of reasons. But one, I think is stigma, and we all have a role in that.
Yeah. Normalize asking for help and normalize offering help, not advice, help or hand, right? I think those are really key takeaways, Melissa. Thank you for that. So I know that first of all, I want to say thank you to our panelists for joining us and for providing your insights and your expertise. We so appreciate it. I think we could have a 2-hour or multiple hour conversation about this. But I really appreciate the opportunity to speak with you all. Also the plug for Face It, Tonya, always a plus. I'm going to pass it over to my colleague, Courtney Downs, who is going to help close us out.
Thanks, Shannon. You took the words out of my mouth. I was going to say we could just keep going for another hour because this was awesome. I think it is really so important for all of us to hear about the services that all of our panelists provide for children, for caregivers, and then the work that everyone is doing to intervene, and then also to promote those protective factors. One of the key takeaways that we heard from everyone is that every parent struggles at some point, right? Like parenting is really hard. And that's why wraparound services and supporting entire families, even kinship caregivers like grandparents, aunts, uncles, and just as Shannon said, like let them know when they're doing a good job, like even during challenging times. Like those are such critical components as we talk about preventing child maltreatment. So thank you again to Tonya, to Emily, Melissa, and Julia for joining us today, for sharing your expertise. And thank you for everything that you all do for kids and families every day. It's really appreciated. We also want to thank Aetna Better Health of Kentucky for their support of today's Advocate Virtual Forum. And then next week, we will be recapping this year's Kentucky General Assembly and the bills that were good for kids. So we will be joined by Senator Reggie Thomas and then also Senator Whitney Westerfield. And then the following week on April 7th, we will be discussing federal and state solutions to end child poverty in Kentucky. We'll be joined by Bruce Leslie from First Focus on Children. And we will be talking more about some of the anti-poverty measures that were included in the American Rescue Plan Act. So as always, we will send you all a recording of today's forum. If there were any resources that were shared, we will send those as well. And we will also include a link to next week's forum in a follow-up email. So thank you all again for joining us and have a wonderful rest of your day.
Thanks, everyone.